Greetings from Meril. For the last 2 decades, Meril's journey in PCI has been rooted in a deep commitment to meaningful innovation. Our early work focused on the next generation desk platforms, beginning with the Biomine, which introduced an ultra-thin cobalt chromium stent with biodegradable polymer-based sirolimus delivery, offering a wide size matrix and a very encouraging early clinical outcomes. This was followed by the Biomine More, still the world's longest tapered drug-eluting stent, addressing long diffuse disease with anatomical precision. We subsequently expanded the platform with our Mind 50, the Biomine branch, and parallelly built the strong leave nothing behind technological portfolio, including the drug-coated balloons and the Meril 100 biohorizontal scaffold, which demonstrated convincing data. From 2007 till 2017, Meril was deeply invested in advancing both desk and metal-less PCI technologies. As PCI has evolved over the last 50 years, we've seen successive technologies replace earlier ones, from POBA to bare metal stent to multiple generations of desks, followed by BRS and DCBs. But in the last decade, the real shift has not been the one technology replacing another. It has been a shift towards lesion-specific treatment. That is where the new chip concept comes in. Rather than viewing chip as merely a complex high-risk PCI, we now see chip as complex hybriding conventional procedures, a dynamic doctrine focused on combining the right tools for the right lesions to achieve the best outcomes. The PRISM PCI concept reflects how PCI is practiced today. Complex disease is like a white light. Only when passed through the prism of imaging and physiology do we truly understand the lesion morphology. The PRISM PCI is about integrating these insights seamlessly with the chip toolkit to deliver precise and predictable outcomes. This philosophy comes alive at the PRISM PCI Conclave 2026, to be held from 16 to 18 January at the Meril Academy in Vapi. This meeting will bring together over 300 interventional cardiologists for keynotes, hands-on sessions, masterclasses, case-based discussions. And we are privileged to have outstanding faculty, including leading Indian and international experts, with virtual keynotes from Dr. Marty Leon, Professor Valentin Fuster, and others. We look forward to welcoming colleagues from across India and abroad. Thank you.